So today we are going to talk about taking the vital signs and doing the cardio-pulmonary examination of a diver who has been victim of an accident. We assume that the diver is alive, so there are vital signs to be taken. First, we need to examine his respiratory status. To do that, we need to know the respiratory rate by minute, and we don't need to spend a whole minute doing that. We can do it in 15 to 20 seconds and then multiply the result to have an estimate of the rate per minute. Then we need to make sure that his breathing is efficient. So the diver needs to take full breaths. His respiration needs to be not too fast, not too shallow, so he can deliver enough oxygen to all his tissues. We also need to look for signs of respiratory distress. That would be a really fast respiration, a respiration that would be too shallow, or movements of the thorax or the abdomen that would be abnormal. So we need to make sure that the thorax is going up and down in a simultaneous rate on both sides of the chest to make sure that there is no trauma to the rib cage. We also need to look for signs of barotrauma. That would be a pneumothorax or a pneumomediastinum, which is air in between spaces that there is not supposed to be air in. How do we look for that? We look for what is called subcutaneous emphysema. That is bubbles between tissues right under the skin. We need to feel with our hands and also to listen with a stethoscope. We look for signs of bubbles, and that would be like comparing it to a bowl of Rice Krispies. So we can hear crackling sounds when we listen with a stethoscope, or we can feel bubbles under the skin. You can feel them on the thorax or around the neck. Then we also need to listen for either the presence or the absence of breath sounds. The absence of normal sounds is a cause for concern. That would be indicative of the presence of a pneumothorax. And the presence of normal sounds on both sides of the chest is reassuring in that fact. If there is a presence of abnormal sounds, that can be indicative of pneumothorax, hemothorax, which is blood around the lungs, or that could be also a sign of near drowning or immersion pulmonary edema. We also need to look for the circulatory exam. So we need to know that the heart is performing its job adequately. We need to know the heart rate per minute, but we can measure it only for 20 seconds and then multiply the result to obtain the minute heart rate. To do that, we need to know how to take the pulse. We can take it in different places. The first one would be at the neck, the carotid pulse just beside the trachea. We can also look for it around the femoral area, which is just underneath the groin area. And we also we can also look for it on the radial pulse, which is on the external side of the wrist, just below the base of the thumb. And then we also need to know how to take the blood pressure. There is two components to blood pressure. That would be systolic blood pressure and diastolic blood pressure. The most important one in the case of a diver who would have been victim of an accident would be the systolic blood pressure. That would indicate us if the patient is in shock or is in distress. There is a really simple way to do that. Even if you're in an environment that would be hostile or noisy, you don't even need a stethoscope to do that. You just need the blood pressure cuff, which you need to put on the biceps. You need to make sure that the blood pressure cuff is of an adequate size. To do that, there is markings on every blood pressure cuff, so it's easy to do. You need to make sure that it's placed adequately. There is an arrow that indicates that it needs to be placed over the artery. The artery is just in the elbow flexion crease. Once you've done that, you just inflate the blood pressure cuff while you're taking the radial pulse, just at the base of the thumb. And as soon as you feel the pulse disappear, that gives you the systolic blood pressure. You can also look for blood pressure using a stethoscope, which is a bit harder to do, or there are even specialized machines that can take blood pressures automatically, which is the easiest way, but you can only do it if you have the proper equipment. Thank you.